Am I audible? Well, ma'am को बोल दिया लेने. Hello?
You, yes, you
I'm
are
audible,
audible,
ma'am?
Megha.
Okay. Good evening, everyone. Yes, I shall start because I was not audible before. Right. Good evening, everyone. I am Dr. Megha Ladha. Pleasure to have you all as participants and all the dignitaries here. I would request all participants to keep you right. I request all participants to keep yourself in a mute mode. So to this, yes. So now I've already started, ma'am. I request all participants to keep themselves on a mute. Right. And any questions you can put in the chat box so that the speaker can answer later. Okay. Before we start, I would like to tell about IAPWC. IAPWC started on 30th May 2018. It functions under the guidance. Hello. Talk about IPWC. Talk about the introduction. On 3018, it functions under the guidance of National Head Dr. Ruchi Varse and I President Executive Dr. Sanjeev Jha. IPWC works towards conducting public awareness camps, CME workshops, bringing to the professional knowledge and improving public awareness about physiotherapy. We have 5 zones in India with heads for each doctor head. Joint committee coordinators Uttara Mohan and Dr. Priya Khande and Dr. Niraj Angvi. In Maharashtra, IAPWC has conducted 40 plus low-cost activities in various districts. In first corporate IAP conference held in 2000, award for the best state IAPWC. Now, even in this COVID condition, we all have stepped up with webinars. And today, district from our state has conducted webinar on PCOD by our speaker, Dr. Manisha Rathi.
Ma'am, we cannot hear
Let
you
me
at all.
introduce you about our speaker. Dr. Manisha Rathi, she is an MPT, CBR, and has done her PhD and is also a certified yoga teacher from the university. She is a professor at Dr. D.Y. Patil College of Physiotherapy.
Your voice is not clear.
Ma'am, it's breaking. The speed is going very fast. We cannot hear. We did not hear a word you spoke till now.
Okay, I think Dr. Sonal will lead right now. Because of some network issues, I will hand over to Sonal.
Hello, good evening.
Dr. Sonal Bhagat, can you take chat?
Yeah,
Yeah.
good evening, everyone.
And
This is Dr. Sonal Bhagat. It's my immense pleasure to have you all participants and all the dignitaries. I would request all the participants to keep mute to avoid the disturbance and put their questions in the speaker in the chat box, which is visible in the right corner. Before we start, I would like to tell you about IFEWC. Hello. Now today, in the COVID condition, we are having a step up at the hello.
Yes, Dr. Sonal, you continue.
Yes, ma'am, you're audible.
Am I audible? I was not getting it.
Yes, ma'am, you're audible.
Okay.
Dr. Sonal, you're
The next,
audible.
yes, ma'am. We are having today's uh, topic on PCOD by Dr. Manisha Rathi, ma'am. It's my immense pleasure to introduce Dr. Manisha Rathi, ma'am. She is a professor. I'm highly obliged to take over to introduce myself to Dr. Manisha Rathi, ma'am. It was when 2004 I was being introduced to the world of physiotherapy and my admissions in Dr. Levi Patil College, and it was with a fresh faces and blank mind that she enlightened us with what is physiotherapy. Thank you so much, ma'am. I was introduced to the world of physiotherapy by you. It's she is always with a smile and welcoming attitude. To tell you about her, she has done her bachelor's from GMC Nagpur and master's from DY Patil and PhD in DY Patil Vidyapeeth and Allied Medical Sciences. She is a certified yoga teacher. She is bestowing her knowledge since 22 years with a huge professional experience and 19 years of teaching. She has got a Best Teacher Award in IIP Physio in 20th October 2019. Significant Achievers Award at MS PhysioCon 2020 and National Physio Conference. I would like to take over and request ma'am to guide us with her knowledge in PCOS. Over to you, ma'am.
Thank you so much, Dr. Sonal. Am I audible?
Yes, ma'am.
Okay. I'm very much grateful to the whole organizing committee for giving me this opportunity to share my experience and knowledge in the field of women's health, especially with you all. Thanks, Dr. Suvarna Ganveer, State Coordinator IIP Women's Cell, for giving me again this opportunity for sharing my knowledge. I thank Dr. Snehal Patel, State Joint Coordinator, and all the sub-coordinators, Dr. Uttara Mohan, Dr. Priya, and Dr. Nirali also for helping me in organizing this, for helping me in sharing my experience with you all. I congratulate Nagpur district coordinators of IIP Women's Cell team, whole team, Dr. Megha, Dr. Sonal and Dr. Pallavi for organizing this wonderful webinar during this COVID period. Okay, I am really very much impressed by this team, whole team, because you are selected such a wonderful topic right now. This is underprivileged topic. Generally, in the field of physiotherapy, we do not talk about PCOD much, but now the patients or the females are suffering so many females, almost 1 in 10 female is suffering from this PCOD condition, and because of this PCOD, the women's life is completely disturbed. It is a hormonal disturbances, and that's why it cannot be cured immediately, and that's why there is a need in this, that we can explore our knowledge and we can explore our expertise in this field, so that we can help the community by giving some our opinion, our expertise things in that. So I think I really congratulate the whole team for organizing this wonderful webinar. Thank you so much for inviting me, and I think we should start with the presentation. I'll share my screen. Can you
Ma'am,
all
keep
see
it on
the presentation?
slideshow. Full slideshow. First slide.
Yeah, it is in slideshow. First slide, yeah.
Okay.
Is it seen clearly?
Yes. Okay. Okay.
Okay.
Yeah.
Okay. So we'll start with the today's webinar topic, that is role of physiotherapy in PCOD. Myself, Dr. Manisha Rathi, I was already introduced by Dr. Sonal. Today, what we are looking for? We are looking for what is PCOD, its pathophysiology, what are the clinical features of PCOD, diagnostic criteria, how can we diagnose it, and what are the medical and physiotherapy management in the same. Coming to what is PCOD. PCOD is basically polycystic ovarian disease. Generally, nowadays, it is called as polycystic ovarian syndrome because it is not associated with one particular symptom. It has many symptoms which are coming together. And that's why instead of PCOD, it is known as PCOS, polycystic ovarian syndrome. It is heterogeneous multisystem endocrinopathology in women of reproductive age with the ovarian expression of various metabolic disturbances. And this is first described in 1935 by American gynecologists Irving F. Stein and Michael Leventhal. And that's why it is also named as Stein-Leventhal syndrome. What is its prevalence? Until unless we don't know prevalence, we cannot work on it with our major contribution giving in the field of physiotherapy. So prevalence rate is increasing fast due to the change in lifestyle and stress amongst the women. Women have many stresses now. Everyone is working out and managing household. That stress plus there are many other stresses which are coming in their life, and that is one major contributing factor for increasing the prevalence rate of PCOS. And it is common problem in adolescent also nowadays. Global prevalence of PCOS is almost 2.2 to 26%. This huge percentage, 26%, is generally it is because of there is no definite criteria to define PCOS worldwide. That's why this certain countries are considering the other criteria, and that's why it has come drastically up to 26%. But in amongst Asians, if you see, the percentage is 2 to 7.5%. When it comes to India, prevalence rate is about 9.13%. That is almost amongst 1 in 10 adolescent girls are suffering from PCOS. And amongst the women, the rate is slightly lower, 3.7%. Urban females are more affected everywhere because of, mainly because as earlier I mentioned, that lifestyle. This is major contributing factor, and that's why urban females are more affected, almost 22.5%. Now, what is with its pathophysiology? Why it is coming? So, pathophysiology, there are many reasons for, and still exact reason is not known. So, there are few theories are postulated for this, and I will just explain you few. It starts with the disturbance in hypothalamus and pituitary regulations. From the pituitary gland, you all are aware that luteinizing hormone is secreting. So in the pituitary gland, this phase secretion of luteinizing hormone is increased, and at the same time the FSH secretion is decreasing because of the disturbance in hypothalamus pituitary disorders. And this you all are aware, follicle stimulating hormone is necessary for development of the follicle and ovulation. So if there is decrease in FSH and increase in LH level, there is impaired development of follicle over here. And because if there is no impaired development of follicle, you know that ovum is not going to develop properly and it will not release from the matured follicle. And that's why there will be chronic anevolution. So there is no ovulation taking place in PCOS. And because of impaired development of follicle, there will be hyperandrogenism, which leads to, so there is a excess androgen hormone, which is a male hormone, testosterone is going to increase because of this, and this leads to hirsutism, acne, and alopecia. In the other way, if you see hyperandrogenism is occurring, that leads to hyperinsulinemia. That is, insulin resistance is, so there is more secretion of insulin. If more secretion of insulin, that leads to obesity, and obesity leads to extraglandular aromatization. Even hyperandrogenism is responsible for extraglandular aromatization. If extraglandular aromatization is happening, increasing, so that leads to, that enzyme helps in conversion of androgen, extra androgen, which is there, into the estrogen. So estrogen level is going to increase, and that further leads to increase in LH secretion and FSH secretion. So this is a vicious circle. You can see obesity leads to insulin resistance leads to obesity. Then extraglandular aromatization leads to obesity, and vice versa. So this is a vicious circle over here. So when we are going to treat these such females, we need to understand where we need to break this cycle. Okay. Coming to this, there is another theories for obesity and PCOS. How obesity is related with PCOS. You know, if there is a hypothalamus function, a hypofunctioning, there is increased, there will be decreased leptin, which increases appetite. So fat cells are going to be increasing. If fat cells are increasing, that leads to obesity. That means there is a obesity. This leads to insulin resistance, and hyperinsulinemia is going to occur. Because of this, finally, the androgen is going to increase. Androgen increases leads to hyperandrogenemia, and finally PCOS. If PCOS is there again, because of, in again reverse way, if we go, it leads to obesity. So again, there is a circle over here: obesity, insulin resistance, androgenesis, hyperandrogenemia, PCOS, and back to obesity. Then again, similar way, we can see that insulin resistance, if there is an insulin resistance, that leads to hyperinsulinemia. This leads to decreased hepatic production of SHBG, that is sex hormone binding globulin. That causes hyperandrogenism. That hormone, the SHBG, is helps in binding the sex hormone, that is testosterone. If there is decreased production, then there will be increased testosterone level. So increased testosterone, there is hyperandrogenism, that leads to PCOD or PCOS. Then hyperinsulinemia leads to elevated LH and oligo, or an evolution is going to occur, that is again a sign of PCOS. So this is again circle. So you must understand what is pathophysiology. Apart from this, there are genetic factors also which are responsible for PCOS development. Coming to clinical features of all these, PCOS, scalp hair loss is going to occur in 40 to 70% of females. Poor body image and eating disorders are going to occur in 21%. Hirsutism, that is excess hair growth, is occurring in 70% of females. So there is excess hair growth in upper lip or chin area. Anxiety is going to be seen in 4 to 57% of females. Hyperandrogenism, which is a major factor for contribution of PCOS, 60 to 80% females shows this. And then easy weight gain or obesity, 55 to 80% females shown this, and such females are, they cannot lose weight very easily. Then fertility issues are there. There will be infertility, as we have seen. Inovulation is going to occur, ovulation is not going to take place. So there will be infertility. And second is, there will be chances of miscarriage in first trimester of pregnancy because of the hormonal regulation is not proper. Depression is there in 28 to 64% of females because of hormonal problems, as well as because of other issues like fertility and the hirsutism and obesity. So depression is there. Then acne, because of male hormone increasing, acne is going to occur. High level of insulin resistance amongst 30 to 50% of females, that leads to type 2 diabetes. Then cardiovascular issues are going to occur, as we all know. Diabetes is there, that leads to cardiovascular issues. Even central obesity is there in such females, that leads to cardiovascular issues. That there will be hyper cholesterol increases. Then irregular menstruation in 75 to 80% of females is going to be there. Sexual dysfunctions are occurring in such females, and polycystic ovaries are there in 20 to 39% of females. So major symptoms are irregular menses, obesity, hirsutism, and depression. These are major symptoms which we can see. Now, what are endocrinological changes seen in such females? As we have seen already few, I'll just enumerate all these again together. Estrogen or E2 level rises. LH level is raised over 10 IU per ml. FSH level remains normal or it may decrease. Androgen increases. SHBG, that is sex hormone binding globulin level, drops down due to hyperandrogenism. Because of this, there is no binding with the testosterone, so testosterone level is going to rise. Prolactin level rises by 15%. Fasting insulin is going to rise and it will be more than 10 IU per ml. And thyroid function disturbs, that is hypothyroidism, is seen among such females. Now, how can we diagnose this? Symptoms are there, but final diagnosis has to be made. And then Rotterdam's criteria are there, which diagnoses or which confirms that she is suffering from PCOS. There are 3 criteria they are given, and if any 2 are present out of these 3, they are considered as, they are diagnosed as PCOS. Presence of polycystic ovaries on transvaginal USG. That is presence of 12 or more follicles in each ovary measuring from 2 to 9 mm and or increased ovarian volume by it is more than 10 ml or 10 centimeter cube square. If it is more, then it is diagnosed as presence of polycystic ovaries, and these follicles gives appearance like beaded necklace appearance on USG. You can see normal ovary here and the polycystic ovary. You can see that in the periphery of ovary there is the cysts are seen. So it gives a beaded necklace appearance on ultrasonography. And even if one ovary is seen such symptoms, it is considered as polycystic ovary. Then second is biochemical or clinical evidence of hyperandrogenism. Biochemical blood investigations can be done to diagnose this, and clinical evidences like hirsutism, acne, and central obesity, they are considered because of this. And then third is very important is oligo or an ovulation. So if there is no ovulation or there is a delayed in ovulation more than 35 days or 40 days, or even they say that 8 periods in a year is considered as oligo ovulation. In a year, 12 months may only 8 periods are coming, so delayed periods. So this if these 3 criteria may say, if any 2 are present, then she is diagnosed as having PCOS. Now you can see over here how it looks like ovaries. Normal ovaries are like this in first picture. Here normal ovary, you can see there will be follicle, primary, secondary follicle and mature follicle where ovum is there. And for this maturation, you need FSH. And then ovulation is occurring, ovum is released, and then after that the remaining part of follicle becomes corpus luteum, and then this is what is happening in normal ovary. But if there is no FSH, no follicle stimulating hormone present, or if level of FSH is not that much which is required, then what happens? Development of follicle is stopped. So here there is ovum, there is no release of ovum which is occurring, and an evolution is going to occur, and there will be multiple immature follicles present in the ovary. After some period of time they become cyst, and there will be a accumulation of such follicles on the periphery of ovary, you can see, and that gives a beaded appearance, the beaded necklace appearance on ultrasonography. Now this is all about diagnosis of PCOS. Now what we should examine as a physiotherapist when any female comes to us and we are suspecting that she's having PCOS, or she may, or even gynecologists are sending them to you, to a physiotherapist. What we should mainly look for? that is obesity, especially android type of obesity where waist-hip ratio is high, waist circumference is more, then BMI, body mass index, more than 25 kg per meter square. There will be hirsutism and acne, signs of hirsutism and acne. You can observe and you can come to a conclusion that she is having hirsutism acne. There will, because of hyperinsulinemia, they may manifest with the acanthosis nigra. 5% of females are suffering from this acanthosis nigra. You can see here in the picture, you can see a darkened area around the neck. So if a person is having hyperinsulinemia, you can observe such marks on the neck region. Then high blood pressure will be there. You need to assess blood pressure, and generally there will be high blood pressure, or there will be a hyper cholesterol. Cholesterol will be increasing in such females, and pelvic findings which can see from the external are will be normal. So we need to confirm with the USG report, which a gynecologist may be sending you. Lab investigations like LH hormone level, FSH hormone level, thyroid hormone level, and androgen hormone level need to be assessed thoroughly. So we, as a physiotherapist, we can go for this. Even blood sugar level need to be assessed. After an investigation, our main aim, what should be our main aim? As a medical fraternity, main aim for a female who is diagnosed with PCOS is cure a woman with menstrual abnormality, because that is the main problem generally they see. Then to treat her hirsutism, that gives lots of depression and problems to a female. So we need to treat that as a medical professional. To treat infertility, to lose weight, and to prevent long-term effect. Long-term effect in this sense, they are having diabetes because of hyperinsulinemia, and they are having cardiovascular problems, like they may develop cardiovascular diseases later. So your aim of treating this should be like this, a medical fraternity aim. Then how should we treat all these conditions? As medications, which is generally given by a gynecologist or medical professional, we should be just knowing this. We cannot give any medications. So what medications generally they take? They are generally OC pills. They are given OC pills because to regulate androgen level, and these OC pills are combination of an estrogen and progesterone. Then gonadotropin releasing hormone antagonist, we need to give this. That is mainly for the these tablets they have given for the regulation of regulation of the cycle. Then clomiphene citrate with or without dexamethasone has been given by a medical professional. The aim of giving this medicine is mainly to improve fertility. So infertile women is generally taken this medicine so that when ovulation is going to occur properly. And still, if there is any problem with the ovulation, metformin is given along with that. Then apart from medication, what surgeries are done? If there is no cure with the medication and other role, then surgery like endoscopic cauterization or CO2 laser vaporization of multiple cysts is done in the form of surgery. Now main our role is here physical exercises. We have to give physical exercises which with the aim of weight loss. Then yoga, pranayam and meditation are again very helpful for such females, and lifestyle modification. These three things, which are physical exercise, yoga and lifestyle modification, are important from a physiotherapy point of view. Now, are you all aware that these celebrities are suffering from PCOS? First picture you all must be knowing, Sara Ali Khan. She has been diagnosed PCOS earlier, and she was weighing more than 95 kg weight earlier. But with the willpower, with the Pilates exercises, with the very good weight loss training program and diet program, she has reduced now up to 55 kg weight. You know the other picture, Sonam Kapoor, you must be knowing this. She had also suffered from PCOS and now recovered, or at least regulated with her hormonal levels, both of them. So if they can do, why we can't? Coming to the exercise physiotherapy portion in the PCOS, exercises are proved to be a best therapeutic and supportive management in PCOS patient in reducing infertility. It has been observed by a scientist, a physiotherapy scientist, concluded that women with PCOS should be advised to engage in at least 90 minutes of aerobic activity per week with moderate intensity. This is very important. Moderate intensity, 60 to 70% of VO2 max, or you can have 60 to 70% of HR max to achieve improved reproductive and cardiometabolic outcome. This 90 minutes are very important, which is of moderate intensity in a week. If you're going to do slow activity, then it has to be a more duration, maybe 150 minutes per week is also needed. Then how these exercises helps? Exercises reduces the risk and restores fertility and quality of life in PCOS patients through inducing hormonal changes of testosterone, androstenedione, combating obesity, metabolic syndrome, reducing inflammatory markers and increasing immunity. So exercises helps in all this, and that's why it is very important to give exercises in PCOS females. How it helps? It manages glucose and insulin. As we all know, when you do exercises, your excess sugar uptake is going to increase, and then insulin level is going to maintain. It lowers the cholesterol level, which is increased due to hyperinsulinemia, and that's why exercises helps in reducing cholesterol level. It promotes feeling of wellness. This is again very important because such females are suffering from depression. So if you give them exercises, they will start feeling of good, and they will start losing, they will reduce depression level also. Then better quality of sleep, this is needed because they will be under tension, stress and all. So exercises helps in improving sleep. It regulates hormone. This is very important because the whole PCOS is the main problem with the PCOS is hormones. So when you do exercises, it regulates hormonal levels. It reduces, all aerobic exercises or any kind of exercises. If you have performed for some period of time, it decreases LH level and testosterone level. It decreases, then it decreases prolactin level, it decreases insulin level, and it helps in calorie burn, and that's why it regulates it helps in reducing weight loss also. So exercises are very helpful in all these things, which are the general symptoms observed in PCOS. Okay. How we should go ahead with the weight loss? This is our prime role right now. Weight loss, apart from exercises, diet is again very important thing. You must inform, or you must explain your patients with PCOS that eat low carbohydrate diet. They should not have excess carbohydrate. So as far as possible, eat lower carbohydrate diet. Eat food with high water content. Make sure to eat enough fiber so that there is no problem later on with the digestive system. Then eat mini meals throughout the day. You can have 2 hours food. A small quantity of food is important here, and avoid all foods and beverages that contains added fructose and other sweeteners. You must avoid junk foods. We are nowadays because of COVID, everyone is preparing at home and not having junk food, but otherwise you must take care that junk food has to be avoided. Excess beverages which gives excess sweetness must be avoided, and eat healthy fresh food which is going to be helpful for losing weight. Now, how coming to the main part of exercises, aerobic exercises we need to give for such females to reduce the weight. It has been observed that 16 weeks of individualized aerobic exercises. This is very important, individualized, because you cannot have a fixed protocol. Guidelines can be given, and you need to assess patient's capacity she's obese, she may be 90 kilo, 100 kilo, 105 kilo. So you cannot give the same exercise protocol for everyone. So you need to assess everyone's aerobic capacity, and accordingly you can give aerobic exercise training to such females 5 days per week. It is very important. 5 days per week. And it has been observed that these, if you do 5 days per week exercises for 16 weeks, it showed independence of changes in the body weight and adiposity. There is no much change in body weight and adiposity, but there was a significant increase in aerobic fitness and insulin sensitivity, and a significant decrease in total number of follicles, which are measured by MRI. This is a study done, and this is what is important. There is significant decrease in number of follicles, which is main sign and symptom of PCOS. So if follicles are decreasing, that indicates that there is a less chance of immature follicle which are developing, and that's why the chance of ovulation is going to be increasing. Now, how you should give aerobic training? You know that aerobic training is very effective in improving fertility and reducing weight, improving diabetes, improving insulin resistance condition, and hyperinsulinemia and cholesterol level. So how we should give aerobic training? This is what is important. So individualized treatment plan, you need to do it. We need to give warm up for 5 to 10 minutes. Frequency must be 5 days per week, or you can have up to 6 weeks, but every day 7 days per week should be avoided because fatigue will be occurring in these females very fast. So frequency 5 days per week is ideal, and it should be given for 24 weeks. 12 to 24 weeks is very important. You cannot have. Hello. Frequency 5 days per week for 12 to 24 weeks must be given. You cannot give just exercises for 1 month or 2 months and expect recovery in PCOS female, because it's totally a hormonal disorder. So you need a long-term treatment protocol for such females. So when patient comes to you in the beginning, you need to explain them, counsel them properly so that they are ready to do exercises for at least 3 to 6 months. 12 to 24 weeks of protocol is important. Then intensity, high intensity, there can be combination of exercises in terms of intensity. You can give a short duration exercises, or you can give a long duration exercises. If you're giving high intensity interval training like 70 to 75% of VO2 max, VO2 peak for 10 minutes and 15 minutes of active pause with 55 to 60% of VO2 peak exercises. So high intensity for 10 minutes and then low intensity, that is 55 to 60% moderate intensity, you can give for 15 minutes. That way also you can plan a protocol. For that you need to find out the VO2 peak, VO2 max for that patient, or you can use HR max also to calculate this. Then continuous practice, if you're not interested in giving high intensity exercise because there are many problems, patient is having patient is severely obese, patient cannot do high intensity exercises, having breathlessness and other associated symptoms, then you can go for a moderate intensity exercises for long duration, like continuous but it should be given continuously with 60 to 70% of heart rate max, including large muscle group. You have to target large muscle groups. It's so that you can give exercises like running, cycling, or circuit training, or you can give dance aerobics also, or you can give mat exercises where you are giving these exercises continuously. See to it that they are doing exercises with 60%, minimum 60% of HR max continuously for at least 30 to 35 minutes. This is what is very important with the moderate exercise. And if you're giving high intensity interval training, then it's okay, 10 minutes high intensity, 15 minutes low intensity, like that you can shift. Then total duration of the exercise should be 30 to 45 minutes, and it should be fatigue free level. If you feel your patient is getting fatigued at 20 minutes only, in the beginning you can have such program like you can give up to 20 minutes, and then slowly you can increase to 30 minutes and then up to 40 minutes, 45 minutes. But you see to it that she's not getting fatigued. Then type of exercises that you can use treadmill, you can use bicycle, or you can use any whatever modalities or you are having for giving exercises, aerobic exercises, you can do that. And then progression, every 2 weeks you must assess VO2 max again, and 10% of VO2 peak or HR max you should keep on increasing every 2 weeks, so that you are targeting systems continuously. You are not just causing the or stagnated effect in such females, because you're going to give it for 24 weeks. It's not only 4 weeks or 10 weeks program, it is for 24 weeks. So every time you have to keep on increasing the intensity of exercises. So you need to reassess every 2 weeks, find out the new HR max, and then according, or VO2 max, VO2 peak, and then accordingly go for progression. And then in the end you go for cool down 5 to 10 minutes, which includes stretching, which also includes stretching exercises. This is very important. Stretching exercises helps in relieving the DOMS or pain which is coming after the exercises. Apart from aerobic exercises, you can go for resistance exercise training also. This is also be very effective in reducing weight or toning up the muscle and reducing fat mass, and it also helps in improving the insulin resistance level. Insulin which is increased, that also will be regulated with the resistance training exercises. And that's why you can give resistance training exercises also for females who are suffering from PCOS. And how you should give these exercises? You can give again same warm up for 5 minutes every time. It is important to give warm up. It helps in minimizing injuries. Then frequency, because it is a resisted exercises, you cannot give every day. So 2 to 3 days per week, alternate day, you can give resisted exercises. Otherwise, there will be severe muscle pain, DOMS, and re-injury is going to be there. So 2 to 3 weeks per through 2 to 3 days per week, you must give for 12 to 24 weeks. Again, short term is not important in PCOS. It has to be more than 3 months, up to 6 months, up to 1 year exercises. Then intensity, here now you are giving resisted exercises. You must calculate 1 RM of for the muscles which you are targeting, and initially you should give 60 to 70% of 1 RM weight for giving resistance training. Give 3 sets of exercise, 3 sets, 8 to 10 resistance stations you need to select, and every station you need to do 8 to 10 exercise repetitions, like stations like lateral pull down, military press, chest press, biceps and triceps curl ups, abdominal curl ups, split squat, leg curl ups, extensions. Like this, you can choose whatever stations are available in your clinic or in your area, or even if the machines are not available and you want to go for free exercises with the resistance like dumbbell and weighted therabands, therapeutic, you can go with that also. But see to it that you are targeting major muscle groups, and 3 sets, 8 to 10 repetitions in each set for each exercises, and 8 to 10 such exercises you must include. And 1 minute rest pause you must give in between, so that you are in one, every after one set you must give 1 minute rest pause, so that there is no fatigue which is occurring, there is no accumulation of lactic acid. And then you must see, whenever you are in lifting weights, you should avoid Valsalva maneuver, because such females are obese females, they are having android obesity, and they cannot lift, so they will try to lift with breath holding maneuver. That may lead to back pain, that may lead to any other injury happening. So avoid these things, take care of avoiding all these things. Then total duration of time with including warm up exercises and cool down 30 to 45 minutes you can give exercises. In the beginning, as with the aerobic training, I have already explained. In the beginning, if you feel that patient is getting early fatigue, then don't go for 30 minutes or 40 minutes. In the beginning, you can go for 10, 20 minutes also. Train them for 1 week, 1.5, 2 weeks, and then start with 30 minutes to 45 minutes. Slowly improve. And then more dumbbells, therabands, weighted pulleys, whatever machines are available in your clinic, you can use it for giving resistance training. Then progression, repetition or sets can be increased based on the rating of perceived exertion or maximum voluntary contractions using weight. So you need to increase the repetitions. Earlier, as I said, you have given 8 to 12 repetitions per set. You can increase up to 15 repetition, 12 to 15 you can go. If you have started with 8 repetitions, now go for 10 or 12 repetitions or 15 repetitions per set. Or you can increase number of sets also. If you started with 2 sets or 3 sets, you can go for 4 sets also. So progression is needed, but all progression cannot. Sets and repetition don't increase at a time. In the either you increase repetition of few exercises, and then again increase after 2 weeks, next 2 weeks you can increase the repetition of remaining exercises. Then after 2 weeks you can improve the sets. Like that you can progress. And then finally give the cool down, which causes active recovery. Whatever the lactic acid accumulated in the muscles will be washed out, and that is what is needed for reducing DOMS also. Okay, so resistance exercise training is very effective again for improving PCOS condition. Now, as you all know that these exercises, aerobic resisted exercises, we are given for with the aim of weight loss and associated benefits of weight loss. And weight loss, even 5 to 7% over 6 months period, if reduces free testosterone levels and restore ovulation and fertility. In a study, it has been observed that even you just reduce 5 to 7% of weight in 6 months, it is also fine, because such females, because of their hormonal level, it is very difficult to reduce their weight. It's not like this that you start exercises and suddenly they will start reducing 5 kg or 3 kg weight in a month, or in 2 months 5 kg. It's very difficult for them because of the complete hormonal problems. So you should motivate them to that. Even if 5 to 7%, suppose a patient comes to you with 100 kg weight and she is reducing 5 kg weight, she has come to 95, then also you give assurance that you are going to improve your condition, ovulation is going to occur back, fertility is going to be there. Okay, it will improve. So encourage them, motivate them, that is sufficient. It is very difficult for them to lose weight in one suddenly, like you have seen in other cases. They can lose weight, just reduce diet and do some exercises for some period of time, and they lose weight. But in PCOS it is very difficult to lose weight, and that's why long term treatment is important. And you need to motivate them. You find out barriers, what are the barriers, motivators, and need for support before prescribing them any physical activity. What motivators is needed generally, that as I already said, you need to encourage them. Even some amount of weight they are reducing, that helps in boosting their morale. Barriers, like generally family members are there who are continuously wishing them, because of infertility they are continuously telling that when you will become pregnant, we are waiting, and all this. Mother-in-law and husband's pressure, family pressure is there. Even sometimes barrier for not doing exercises, time constraint is there, they are doing job or household activity, so for them exercise for 1 hour becomes difficult. So find out such barriers, and then how we can modify such barriers in a positive way, so that they can do the physical activity in whatever scenario they are present. So you must consider these barriers, must consider motivators, and need for support. You have to support them, you have to explain all these things to the family members also, so that they will support her in doing all these in exercises or taking a proper treatment for PCOS. Then coming to some studies which are found, as I have already told you, PRT is very effective. So effect of PRT on exercises, a study done by Visata in 2016. They have given PRT for 12 weeks. See here, 12 weeks, 4 sessions per week. 2 were supervised in the physiotherapy clinic and 2 were home-based exercises. Like they have been explained how to do exercises using the sandbags, using the resistance training at home. For 60 minutes they've given, and this study concluded that there is significantly effective in improving body weight, lean mass, fat-free mass, and BMI. So body weight has been increased, PRT, but there was decrease in fat-free mass. This is what is, there was decrease in fat mass. This is what is important. And reducing waist circumference, android obesity has been reduced. Waist circumference is reduced, which is again a major problem in such females. And HbA1c level has been reduced. That shows that patient is suffering from diabetes or hyperinsulinemia. So these are in control with the PRT, as well as it has been proved that there was reduction in depression, improved quality of life, anxiety, and exercise self-efficacy has been improved. But there was no change in menstrual cycle was noted. This may be because it was just for 12 weeks session. That may be the reason, and that's why long-term research is needed over here. That's why I told you in the beginning, it should be more than 12 weeks up to 24 weeks. So whenever patient comes to you, you must explain them they have to do exercises for at least 6 months. Then coming to yoga and Surya Namaskar, effects of Surya Namaskar are again proved to be very effective in treating the patient with PCOS, females with PCOS. Surya Namaskar. Hello. So effect of Surya Namaskar in females with PCOS, Surya Namaskar with empty stomach. If you do it for 5 times in the beginning every day, and then slowly increasing the number, you can increase up to 30 times in the period of 3 months, and then further increase up to 50 times also you can do it. See to it that her condition, how is it? Because she is obese, he has other problems, so it is very difficult for her to increase this number from 5 to 30. So you need to monitor them, you need to explain them properly. If there are any musculoskeletal problems associated, so you need to give them some alternative management. Even power Surya Namaskar is also beneficial in such females, but you must take care that she is not having any other associated problems, other musculoskeletal problems. She is not going to suffer with this. Practicing Surya Namaskar with pranayama. Pranayama in the form of Anulom Vilom, Kapalbhati, then Bastrika Pranayam. These are again effective in treating PCOS. So Surya Namaskar with pranayama exercise for 4 months. They have observed that they are helpful in rejuvenation of physical and mental health. And also it has been observed that it facilitates to regulate menstrual cycle and reduces BMI and hair fall. And that's why Surya Namaskar with pranayama has been advised in the management of PCOS. So you must be knowing, all of you must be knowing all 12 steps of Surya Namaskar. So if they are doing it properly, definitely they will be getting cure from the PCOS over the period of time. Then Yogasana, again it has been proved that Yogasanas are very effective in treatment of the PCOS. Yogasana should be performed every day or at least 6 days a week for 30 to 45 minutes, and then you can get to see the results. These Yogasanas are Baddhakonasana. You must be knowing the butterfly pose. So sit comfortably. The atmosphere should be comfortable, well ventilated. Sit in a quiet room and then perform these asanas without any disturbances, hindrances. Okay, so Baddhakonasana, that is butterfly pose. Bhujangasana, cobra pose. Then you can do forward Naukasana. Dhanurasana, that is bow pose. Marjarasana and Vitilasana, that is cat and camel pose. We are all aware about this exercise. And then Padmasana and Shavasana. You all are aware, Padmasana and Shavasana. Along with these asanas, you can give Bharadvajasana, where you can sit in side sitting position and stretch yourself. Then Viparita Shalabhasana, you can see here Viparita Shalabhasana, lying in prone position and lifting both the legs together and hands together. So weight bearing is occurring on lower abdomen or pelvic region. That helps in improvement in the PCOD condition, PCOS condition. Then Balasana, where you can sit in Vajrasana position and bend forward as much as possible, so compressing the whole abdominal area. Then Prasarita Padottanasana, where you are spreading both the legs and slowly bending down forward, touching your forehead to the plinth. So it is also effective in PCOS. And Chakki Chalasana. You can see you have to sit in long sitting position with legs apart, and then you have to move forward and backward as much as possible in a circular manner. Like you are doing chakki, you must be knowing what is chakki, and then you are doing chakki chalasana over here. So all these asanas, Baddha Konasana, Bhujangasana, Forward Naukasana, Dhanurasana, and Cat Camel Pose, Padmasana, Shavasana, and all these asanas, if you give them for 45 minutes, 30 to 45 minutes, each asana you can have in the beginning for 1 or 2 times, or you can increase up to 3 times in a day, 3 times, 3 repetition for each asana, and in the progression you can increase the duration of holding. Holding is very important, and you must do breathing exercises normally along with this. You should not hold your breath and do these asanas. So if you're performing these asanas, you can, for such females, they will definitely get to see a good cure. Then a study done by myself only, along with one PG student, Dr. Veda. We have conducted a study on PRT versus yoga in female with PCOS for 12 weeks. Again, remember this 12 weeks, 3 days per week we have given these exercises, and for 30 minutes we have given, and remaining 3 days we asked them to do exercises at home. So 6 days a week exercises were performed, 3 days were supervised and 3 days were unsupervised asanas. In Yogasana, these 12 asanas we have given 3 times each asana. Progression was given by increasing the holding time. And then other group we have given PRT, which I have already explained you how should be given PRT exercise. 60% of 1 RM in the beginning, 2 sets, 8 to 12 repetitions we have given, and progression every 2 weeks we have given, wherein we had increased repetitions and sets also. So, and we found after 12 weeks of exercises, we found body weight and BMI was significantly reduced by yoga exercises, whereas dysmenorrhea was improved by PRT. There was no much significant changes observed in infertility and menstrual problems. Again, I can contribute this because we have given just a 12 weeks, since it was a PG student involved in, we had to restrict our time. So it was 12 weeks session, and that may be the reason why we couldn't get much changes in the infertility and menstrual problems. So if you give more period of time these exercises, I am sure that you will get definitely a good results. Then coming to Yogasana and naturopathy in PCOS, naturopathy interventions and yoga was given for 6 days, again 12 weeks, excluding days of menstruation. They have given together these naturopathy and yoga combination, where yoga was included, the yoga postures, pranayama, relaxation and kriyas, and naturopathy was included, hydrotherapy, mud therapy, manipulative therapy, and fasting and natural diet therapy. And they found that there was significant improvement in the significant improvement was observed in ovarian morphology, where they have seen decreased duration in intermenstrual cycle. In the beginning of the study, the females who were included in the study had almost intermenstrual period cycle was around 45 days, which was reduced to 31 days after these 12 weeks of exercises. And significant difference in anthropometric measurements was also seen, like body weight, BMI, chest circumference, waist and hip circumference, and mid-arm circumference in 2 groups. So it helps in weight loss as well as it helps in improving the ovarian morphology also. So this was about yogasana and naturopathy. And coming to lifestyle modification, since we are all aware that lifestyle is again a major contributing factor for development of PCOS along with the other reasons, reduction in addiction, lifestyle modification is very important. So reduction in addictions like smoking, it is very important to quit smoking. Even in urban females, rural females do smoke, and they have tobacco also, so that addictions has to be reduced immediately, or you can say it should be stopped immediately. Then balanced diet, you must have balanced diet which is including of all vitamins, fibers, and a small amount of carbohydrate and proper protein. And if a balanced diet has to be there, which includes fresh fruits also and salads also, sprouts, proteins, everything. And then regular exercises must be followed by all the females. Is not like this that one day they are doing exercise and other they are not doing, or they are doing in a group where they are spending more time in talking to each other only, and not concentrating on exact intensity of exercises. So that should not happen. So regular exercises must be inculcated in their lifestyle itself, and maintain stress-free environment. This is again important. So if you modify lifestyle, definitely you're going to change the or improve the PCOS symptoms. Like there will be improvement in free androgen index, there will be improvement in weight and body mass index, and PCOS, overall PCOS will be improving. Long-term effect of lifestyle modification on PCOS is yet to be studied on menstrual regularities, live births, and miscarriages. So there is again future scope. All these UG students or PG students, whoever is attending, you have tremendous scope of doing research in this field. You can do many research in PCOS females, starting from prevalence in various conditions till the management and a long-term management. So you can do a longitudinal studies considering the exercise protocol in them. So it is very important to go for holistic approach, or a holistic system of lifestyle changes, diet and exercises must be there to get rid of PCOS, polycystic ovary syndrome, naturally and permanently without any medication. So I think we must take care that we are doing all possible, uh, we are giving all possible help, whatever, starting from the counseling, reducing depression and reducing anxiety, reducing their tension, stress. Starting from that counseling to lifestyle changes and some description about what to eat, and you can send them to nutritionist also. And exercise we must give them correctly and properly, and in the beginning itself tell them it is a long-term management, so they will not get rid that I'm not getting any improvement in small period and all. They will not be expecting this. Okay, so this is all about the PCOS. Thank you. Thank you so much.
Hello. Thank you so much, ma'am. Myself, Pallavi. Am I audible to you, ma'am?
Yes, yes.
Yes. Ma'am, you explained the topic very well. There are many questions related to topic. I'm putting you a few questions. Just first one is, if the person
Yes,
is having PCOS and is
yes.
thin, so what's the management from physiotherapy point of view?
If she is
Am I
having
repeat?
PCOS, yeah,
And thin and
PCO
is thin.
thin. Uh-huh.
Ma'am, I'm repeating the question
Yes,
again.
yes. She's thin. I got to know. She's thin and
Okay.
she's having
Mhm.
PCOS. Yes.
Yes, ma'am.
Since we have seen the symptoms, we observe that every female is not obese. The one who is suffering from PCOS. but thin है इसका मतलब ये नहीं है that she should not do exercises, because exercises will regulate the other hormone levels also. So she can continue with all these exercises with proper diet and lifestyle modifications. And these exercises, aerobic exercises also she can perform. She can perform resisted exercises, which is going to be helpful for her in improving her body weight also, or muscle tone up in her muscles also, and it will directly or indirectly help in treating PCOS also.
Thank you so much, ma'am.
Okay. Mhm.
Ma'am, one of my colleagues has asked you,
Yeah.
shall I proceed with next question, ma'am?
Yes, yes.
Yes, okay, thank you, ma'am. PCOS diagnosed woman with less bleeding, but periods is regular every month. After
Hmm.
few years of diagnosis and homeopathy treatment, now
Hmm.
can it be corrected by physiotherapist? If so, what can be done?
What exactly you want to correct? The flow. The
Uh,
cycles are regular, you said.
what Yes, ma'am, but she is diagnosed with PCOS and taking the homeopathy treatment. So along with
Hmm.
that, she wants to know what physiotherapist can do again.
Uh, so same, see, if her menses are regular, she has been taking homeopathy. So as I said, there is a holistic approach. So she can do physiotherapy exercises also along with the homeopathy exercises. So these aerobic exercises, whatever she feels she is comfortable with, aerobic or yoga exercises, she can perform all these exercises to because it is not a short term treatment, it is a long term. There are many consequences which are occurring because of PCOS, like diabetes, then hypertension, cardiovascular diseases which are occurring because of this. So that can be regulated along with the homeopathy treatment with the help of exercises. So she can continue exercises in such scenario.
Okay, okay. Thank you, ma'am. Can I next question, ma'am?
Yes.
Yeah. What is the physiotherapy goal with this particular yogasana? What is the physiotherapy
Physiotherapy.
goal?
Huh?
Physiotherapy.
Hello. Hello. Hello.
Hello, ma'am. Am I audible to
Yeah.
you?
Yeah. Yeah.
Yes. What is the
What is the question?
physiotherapy goal? Ma'am, what is the physiotherapy goal with these particular asanas?
These all asanas which I have shown you in my PPT. These asanas are helpful in weight reduction. They are helpful in regulating the menstrual abnormalities. They are helpful in reducing the cholesterol level, as well as they are helpful in regulating insulin. So all these asanas, if you perform, they definitely the flexibility, which is the other part, which is not related to PCOS, but related to PCOS, as I said, it helps in regulating the menstrual cycle and it helps in reducing the weight, which ultimately corrects the PCOS problem. So these are the aim. Okay.
Okay. Yes. Thank you so much, ma'am. Ma'am, next question.
Yeah.
What is the role of PF exercises in PCOD?
Pelvic floor exercises.
Yes, ma'am. Yes.
Mhm. Pelvic, see, PCOD, there is infertility, there is no delivery as such happened, or there are, as such, there is no pelvic floor muscle dysfunction observed or reported in females with PCOS. But to be like, if she's a married female and she's taking treatment, she's doing other exercises. So along with that, if she does these pelvic floor exercises, it helps in core muscle strengthening, which helps in improving other conditions also. So it's not compulsorily they must practice pelvic floor exercises, but considering the benefits of pelvic floor muscle strengthening exercises, in case of like if she's doing aerobic exercises, she's developing if she's developing back pain because of android obesity, her posture is not corrected, is not correct, is hyperlordosis is increased. So in such case, you need to strengthen core muscles, and that's why pelvic floor muscle being one of the core muscle, you can go for strengthening this. But as such active role of pelvic floor strengthening in treating PCOS is not there.
Okay. Next question, ma'am. Thank you.
Yes, thank
Ma'am, one of my colleagues is asking you, ma'am, if the patient is thin, she is doing regular exercises as diagnosed with PCOD, not taking any medicines,
you. Yes.
and not having
Mhm.
blood flow during the periods, but having the blood clot. So, is there any exercises for normalizing blood flow?
She's having blood clot also.
Yes, ma'am. She is saying that she is having the blood clots only to normalize the flow. What is there any kind of exercises?
Specific normalizing flow, you can again, as I said, PRT, progressive repeated exercise training is effective in regularizing the dysmenorrhea or the menstrual flow. And you can perform yogasanas also for regularizing this blood flow. So PRT, if you practice it properly with all the strengthening abdominal curls and push-ups and all these whatever exercises I had mentioned. So if you practice PRT, it will be helpful in regularizing blood flow
Thank you so
and
much, ma'am.
reducing dysmenorrhea.
Thank you so much, ma'am. One more last question, ma'am.
Mhm.
What is the meaning of hirsutism? You know,
Hirsutism is excess. Because hirsutism basically occurs because of the increasing male hormone, that is testosterone. Androgen is increased, and because of the SHBG reduction, there is testosterone flow in the blood is increasing, and that this hirsutism is causing. This testosterone is causing hirsutism, where there will be excess growth seen on the upper lips, on the chin, excess hair growth. You can see hair growth on the chin area like a male person, or on the upper lips, or even on the face, you can see. But there will be very less chances of developing virilism, where excess hair production on the chest area and hand is seen. Virilism is less, but hirsutism is very common.
thank you so much, ma'am. Ma'am, I'm handing to the vote of thanks now. It's my great privilege to have been asked to propose a vote of thanks on this occasion. I, Dr. Pallavi Sade, on behalf of IIPWC Nagpur district team and the entire family of my IIPWC team, extend my sincere vote of thanks to one and all. A big thank you to you, Dr. Manisha Rathi ma'am, for your presence and took out your valuable time of busy schedule. Your own ideas and style of explanation of the topic is fabulous. Today, I learned many new things. Thank you so much, ma'am. I wish to express
Thank
my
you.
gratitude to our national head, Dr. Ruchi ma'am, and our zonal head, Dr. Pooja ma'am, for providing encouragement and the support to organize this event. Thank you so much, ma'am. Event like this cannot happen over the night. The wheel starts rolling weeks ago. It requires planning and a bird eye for details. Yes, guys, yes, we have been fortunate enough to have been backed up by a team of our state coordinator, Dr. Suvarna Ganvir ma'am, and Dr. Snehal ma'am, our state joint coordinator. Thank you so much, ma'am, for your guidance. I extend my heartfelt thanks to all my state sub-coordinators, Dr. Uchra ma'am, Dr. Nirali ma'am, Dr. Priya ma'am, for your cooperations in the organizing this webinar. Thank you once again. Last but not least, as no program can become successful with a single person. So I extend my big thanks to our all participants in webinar. Thank you guys for making this event successful with your participation. With this knowledge and beautiful memories, I declare the end of webinar session here. Please kindly put your feedback from a link which we have shared with you in a chat box and also on the webinar group also. Guys, do take care. Good night. Thank you so much.